Evening to everyone. This is Aliyah Evangelista from the Asia eHealth Information Network. Welcome to our special 18 hour tonight on HealthXPH. This webinar is attended by 25 countries in South and Southeast Asia, mostly members of AHIN. If you're not yet a member of the network, it's okay, and we'd love that you join us at www.ahin.org. Our topic for tonight is HealthXPH, a tweet chat on emerging technology and social media in healthcare. Some things to remember before we start our session: our platform, our ways to participate, our program, and our email feedback. We're now using Cisco WebEx Event Center, and our short link is bit.ly.com/AHINHour. Our room number is 869-749-239, and our password is Manila123. I'm glad to say that our meeting tonight could be accessed via mobile, and as you can see on your screen on the left side, in the right side, Dr. Gia Season is on mobile and will be presenting later. Your mic will be mute for the rest of the meeting, but you can actively participate by sending your feedback, chatting your response, your questions, and answering the poll. You can send your feedback with a yes or a no, a too fast or a too slow, an applause, and a virtual laughter. You can also chat by typing your message to the panelist or the host, or both in the meeting room. But I have a warning for everyone in our meeting tonight. You cannot chat your responses to all attendees in the meeting room because this is the default option of WebEx. You can post your question by assigning the question and typing your question in the Q&A box located at the right panel of your screen. You can also use the poll option later if ever any of our speakers would be registering a poll to us. Our program details will run 45 minutes to 1 hour, and you can send your Q&A as it arises from your head in the Q&A box. And lastly, please check your email as the Secretariat will be sending an evaluation form of this session. I'm very glad that we have our very respected online doctors who will be delivering our topic for tonight on HealthXPH. So just an overview, HealthXPH is a regular tweet chat registered on Simpler under the healthcare hashtag project. It tackles health and technology topics. Our speakers are Dr. Iris Isiptan and Dr. Gia Season, and we will have more inputs from its founders, also Dr. Remo Aguilar, Dr. Narciso Tapia. So I welcome now you all to our session for this evening. I now turn the presentation ball to Dr. Iris Isiptan for her session. Hi, Dr. Iris.
Hi.
Great to have you, ma'am, in our session. So you can start now, ma'am. Take it away.
Okay. I will just make this full screen. Is that showing up okay?
Yes, ma'am. It's fine.
Okay. So good evening, everyone. I'm very happy to be able to share with you HealthXPH, a tweet chat on emerging technologies and social media in healthcare. So this is the group of hashtag HealthXPH. That's me, Endocrine Witch. And then there's Dr. Remo Aguilar at BoneDoc, and then at Gia Season, Dr. Season, and Dr. Narciso Tapia at Cebu MD. We have also welcomed a new team member, Dr. Helen Madamba. So the talk will be in 3 parts. What is the anatomy of a tweet chat, the healthcare hashtag project, and what is HealthXPH. Dr. Remo Aguilar will actually be giving the last part of the talk if the electricity holds out in Mindanao because there are scheduled brownouts there. So what is a tweet chat? So on the screen, you can see my Twitter home profile. I hope that the audience right now already have Twitter profiles, but if you don't, this is what it will look like. So on the top bar, you will have the notifications bar, where you also have access to your direct messages and the search bar. As you can see, I have used my full name for my profile because I want the people to know who I am. I am not hiding under a pseudonym, although my Twitter handle is endocrine_witch. So as you can see there, I have a couple of hashtags under my name, and one of that is hashtag HealthXPH. So a tweet is a 140-character message that is posted via Twitter. And when you follow someone on Twitter, it means that you are subscribing to their tweets as a follower. So if you follow me on Twitter, you will be able to see in your feed the tweets that I send out. Now, there are several researches already about what is happening on Twitter, and one thing I'm interested in is to actually categorize tweets. There are several ways now to categorize tweets, whether they are news, phatic, spam, conversational, pass along, or simply a status update. So for example, if you are following a news outlet, then you will be able to access news via the tweet. Sometimes it will have pictures like this. Or if you're following a newspaper, some of them also issue tweets about the news already. In our area, which is sometimes prone to typhoons and disasters, we also have advisories that we can get on Twitter from respected government agencies. Now, let me tell you a story about what can happen if you are on Twitter. So we were sharing from HealthXPH. We have a social media manifesto for medical professionalism online. And this is an example of a blog post I wrote and tweeted so that people can read what I had said about this particular manifesto. And then this was picked up by someone, Sean, because Gia had already tweeted the same. And this is the resulting conversation that happened. So Sean was actually sharing our manifesto because there was an ongoing conference, and he thought that the conference topic was related to our social media manifesto. And then Alicia, whom we didn't know, just waved at us, and that's how sometimes conversations can start on Twitter out of common interests. So I looked at Alicia's profile, and this is what happens when you meet random people on Twitter. You look at their profile. That's why it's very important that you have your information there so that you can find people with common interests as you. We also looked at Dr. Foreman and Ed Bennett. So when you look at the profiles, then you can decide to follow these people, and they may decide to follow you back, and then there might be a significant interaction as to the topics that you are mutually interested in. So there was a hashtag there, and the hashtag was NatCon15, which is actually the National Council for Behavioral Health. It was a conference ongoing that day that Sean was tweeting, and that conference was also registered on Simpler's Healthcare Hashtag Project. So what is a hashtag? A hashtag is used to mark keywords or topics in a tweet. It is created organically by Twitter users as a way to categorize messages. So hashtag was actually the 2012 word of the year, and somebody even named their baby hashtag. So now let's get to defining what is a tweet chat. A tweet chat is a prearranged chat through tweets that include a predefined hashtag to link those tweets together in a virtual conversation. So after this, at 9 o'clock, we're inviting everyone to join us for the HealthXPH tweet chat so you can actually experience what being in a tweet chat would be. So we got this idea from hashtag HCLDR, which stands for Healthcare Leaders, and this is how it would go. So for example, the moderator here, it was Lisa Fields, would talk about the topic. So she will give you the link to the pre-chat blog post. So for HealthXPH, our blog is at www.healthxph.net, and you can see there what the topic will be for tonight. Now, we will label the questions T1, T2, T3. This usually happens after 10 minutes of introduction. So at 9 o'clock, when we come on, we say, welcome to HealthXPH, and everyone just says, here I am, joining, what my name is, and where I'm from. And then the moderator will move on to T1, the question, and then, of course, you have to include the hashtag so that everyone can read what you have tweeted. After the question has been raised, then anybody joining the tweet chat can now tweet their answers. So as you can see here. You can also include links to your tweet. So if you want to say more but is unable to do so with the limited 140 characters, you can always refer to a link as well. So that is what happens in a tweet chat, and after my talk and Dr. Aguilar's, Dr. Gia Season will talk more about tweet chat etiquette. So let's move on to what is the healthcare hashtag project. So there are 200 million active users on Twitter as of 2013, so there should be more by now. And we have a record number of 500 million tweets per day. So if you are a healthcare professional and you would like to use Twitter in a professional manner, how would you go about it? So that's how the healthcare hashtag project came to be. So the goal of the healthcare hashtag project is to make the use of Twitter more accessible for providers and the healthcare community as a whole. By lowering the learning curve of Twitter with a database of relevant hashtags to follow, we hope to help new and existing users alike to find the conversations that are of interest and importance. So what happens? If you go to www.simpler.com, you can search by hashtag. For example, if you wanted to find out more about the hashtags associated with the word cancer. So you can just type it in, and what you will see will be a cancer tag ontology. So for example, the #1 trending at the time for cancer would be hashtag GYNCSM. So that stands for gynecologic cancer social media. So you can now start following that hashtag if that is of interest to you. Now, when you do that, it will also show hashtags that are related to one another in the healthcare field. So for example, if I search endocrine, it will give me the hashtags not only for diabetes, but also for thyroid, obesity, gout, etc. Now, the hashtags have also been clustered or organized by system. So as you can see here, by body system, blood, cardiovascular, digestive, etc. Now, here in the Philippines, we have tried to use Simpler also for our conferences. So for example, PCP stands for Philippine College of Physicians. So this was PCP 14 for last year. And this year, we also registered hashtag PCP 15. So that during the conference, people who are attending can actually tweet what they have learned or what they are seeing, what is happening at that time during the conference. We also tried it for Asia-Oceania Congress of Endocrinology, which was hosted by the Philippines. So if you have concurrent sessions happening, I could be in Ballroom A, and Dr. Gia Season could be in Ballroom B. And even if I am in Ballroom A, I can check the tweets of Dr. Gia, and I can see what's happening in Ballroom B, more or less. When you look for a hashtag on Simpler, you can also see the frequency of use of related hashtags so as to facilitate hashtag selection. So sometimes there might be many hashtags associated with the topic you are interested in, and you can choose which hashtags you will choose to follow. So when you select a particular hashtag, it will show you the most frequent users and the most frequent mentions with each hashtag. So here you can start following actual people on Twitter because you know that they are interested in the topic that you are interested in. So The website also ranks which healthcare hashtags overall are most popular at any given time. So as you can see here, according to tweet chats, conference, or diseases. When you go to the hashtag that you have selected on Simpler, it will also provide you a live feed of the conversations related to each of the hashtags. So you can currently explore what's being shared in your healthcare topic of choice. So the healthcare hashtag project is sort of an easy way to start off in Twitter if you are interested in using Twitter as a healthcare professional. Can I check first? Dr. Aguilar, are you there? Hello? Is Dr. Aguilar there?
Hi, Dr. Iris. I think Dr. Aguilar is Dr. Aguilar is here, but I think his mic is on mute on his computer. So but or we're having technical problems in his side. Dr. Aguilar, can you speak on your microphone?
Hello, Dr. Iris. Good morning, everyone. Today, can hear you clearly.
Yes. Okay. So can you take over? I'll just run through the slides for you.
Okay.
Go ahead, Remo.
So, Dr. Aguilar, am I going to pass the presenter controls to you now, or would you be delivering your session, and Dr. Iris will be having the controls on her slide?
Yeah, Dr. Iris.
Okay.
All right. So I think Dr. Aguilar is fixing something on.
Okay. So I'll just go ahead.
I think you can go ahead, Dr. Iris.
Okay. So now we're going to talk about how HealthXPH actually started, and I wrote a blog post on that last December. I had actually wanted to go to Doctors 2.0, and I had followed Denise Silver because Gia Season had been following her as well, and I saw the things that she was tweeting about. And I said I wanted to attend, and Dr. Remo had then told me, well, why not we should organize our own social media conference here in the Philippines first. And the first thing we wanted to do was to attract healthcare professionals who also had an interest in social media. And we felt that having a tweet chat might be a good first step to find out who are these other healthcare professionals who are interested in social media. And that's how it began, and we found Dr. Gia Sison and Dr. Narciso Tapia, and we decided to have the HealthXPH tweet chat every Saturdays. So that's a weekly schedule. In the beginning, we had it in the mornings, but most Filipino doctors also have clinics seeing patients during Saturday mornings. So later on, we moved that to having it every Saturday night, like tonight at 9 p.m. So Dr. Remo Aguilar defined what is HealthXPH in this blog post, and he said that it is a collaborative effort of healthcare stakeholders, healthcare professionals, institutions, academe, patients, and policymakers. It will discuss, use, and continually push the boundaries of social media and other emerging technologies in healthcare to impact the Philippine healthcare landscape. It will encourage collaboration and application of emerging technologies to improve delivery of healthcare. and it aims to educate all healthcare stakeholders. It is open and free for everyone to join. So social media is going to impact Philippine healthcare, and in fact, I think it is already impacting on Philippine healthcare, and we want to make it a positive impact. So social media and other emerging technology is making it easier for patients to access their healthcare professionals, institutions, and policymakers. And HealthXPH as a group would like to give insights on how to effectively manage this upsurge. Social media also opens new possibilities to participatory medicine practice in the Philippines, and HealthXPH is taking advantage of this. So we also have a Facebook page for HealthXPH, and we are using the Facebook page for us to announce our tweet chats. That might sound counterintuitive, but at least for the Philippines, there are more people still on Facebook as compared to Twitter. So it's easier for us to remind people to be participating in our tweet chat using our Facebook page. We used to hold Google Hangouts on air, but then there were some technical difficulties in doing that. So we decided to just have tweet chat conversations. So one of the things we looked at from the beginning was how to track our metrics. And that's how Simpler's Healthcare Hashtag project is actually a good way of doing this because they measure impressions. So what we did was to register our hashtag, and it's free to do that. You just go to the website, and there are several steps on how to register your hashtag. And once it's registered, if you inform them of the time that your tweet chat happens, they'll keep track of the statistics for you, and you can pull it out from the site. It will also provide a transcript of that 1-hour tweet chat. So one of the metrics that you have on Simpler is actually impressions. So that is a mathematical formula, which is the number of tweets per participant multiplied by the number of followers that a participant currently has, and then you add up all of that for all the participants. So this is an example of what you will see on the Simpler page for HealthXPH, the metrics. So for example, this is the very first tweet chat we had, which was in January 3, 2014. So as you can see, we had 263,393 impressions. There were 13 participants at the time, and there were 84 tweets for 1 hour. So you can see the mentions, you can see the tweets, and the number of impressions generated by each of the participants. And when you add all that up, then you will get the total number of impressions. So this is an example of the tweet chat blog post. So for me, since I have my own blog, I also put it on my blog and also on the blog of healthxph.net. So this is a particular one that I hosted last April on patient and peer mentoring. So I will have the 3 questions there, and I will have some background information. So usually we advise that for you to join the tweet chat, if you can read the tweet chat blog post so that you can participate more actively. But we also have people who just serendipitously happen to be on Twitter during the time of the tweet chat, and they just can chime in as the questions are actually tweeted out. So for that particular session that I had, the impressions we had reached already 7,345,360, and at that time we had 42 participants. So our HealthXPH community is definitely growing from the time that we started in January 2014, and we have many people who are regulars already stopping by every Saturday night, 9 p.m. Manila time, which is also 9 a.m. Eastern time. So this is sort of like a year's statistics, which you can also get, because on Simpler, you can simply put in the dates, the time frame that you want it to generate the statistics, and then you can have a rundown such as this. And to also give you a picture of the people who are tweeting in during HealthXPH chats. So if you want to monitor your activity, it will also give you a graph such as this. So you can see whether you are going up or going down as far as your tweet activity. So this is over the span of a few months for 1 year from January 2014 to February 2015. If you make it smaller, for example, just for the month of January, you can see that there is an increase because that's every Saturday when we all meet up for HealthXPH tweet chat. So that's what we're trying to do really, to enable a community of healthcare professionals who are interested in using social media for healthcare. And there are several ways that we can measure the social network as far as the total number of tweets contributed, the number of times a person is mentioned or replied to, which is the in-degree centrality, and the number of times a person mentions or replies to others, which is the out-degree centrality. So we are hoping with time that we at HealthXPH could generate research about our community as well. So it would look something like this, where you have the stats that we can get from Simpler. Now, I don't have here all the topics because it's been more than a year already, but just to give you some preview of what it has been all about. So most of the time, it's about social media or the internet or mHealth or quality healthcare. So for tonight, Dr. Gia Season is moderating the HealthXPH tweet chat, and it will be about the e-patient revolution. So we're trying to do some work with this HealthXPH community that we've started, and so we went to Mark Smith's seminar because we wanted to know more about NodeXL, which is a tool that you can use for social network analysis. And if you use NodeXL, you can generate a NodeXL map such as this, where you can see clusters of individuals talking to each other. Those green lines and red lines actually represent tweets going back and forth between those people on Twitter. So you can also have the underlying Excel worksheet. And lately, I see that NodeXL also has a 3D representation already of these social networks. So we also felt that since we had gathered some participants already for our HealthXPH tweet chat, that we should call for a healthcare and social media summit. And so after a year, with support from Health Informatics Inc. and some partners, including the Philippine Council for Health Research and Development, we were able to call for a Philippine Healthcare Social Media Summit last February in Cebu. So we were able to attract 450 attendees. And our plenary speaker was actually Pat Rich from the Canadian Medical Association. At this HealthXPH, at this Healthcare and Social Media Summit, we were able to release our HealthXPH manifesto. So this manifesto was actually crowdsourced because we had several tweet chats relating to protecting patient privacy and confidentiality, as well as rules on what should guide practitioners when they are interacting with others on social media. Because we are only 5 doctors who are in this group and we are not in a governing body, we thought that we should not issue guidelines or regulations, but just have a manifesto. Because a manifesto is actually a statement of what we intend to do as individuals. And if you would like a copy of this manifesto, it is available for signing at our website, www.healthxph.net/manifesto. So at that meeting in Cebu last February, we were able to get signatures from the participants and most significantly from the President of the Philippine Medical Association, Dr. Minerva Kalimag, and the President of the Philippine College of Physicians, Dr. Anthony Leachon. Also present was former Undersecretary Dr. Ted Herbosa, who is a regular in our HealthXPH tweet chat. Now, going back to the beginning of the story, I wanted to go to Doctors 2.0, and finally, after more than a year, I will be going to Doctors 2.0 in June to talk about what we have been doing here at HealthXPH. And we also tried to participate in the Simpler Research Challenge with Medicine X of Stanford. And I'm proud to say that a team from HealthXPH is one of the 9 semi-finalists for the category, How is Social Media Transforming Healthcare in 2015? So that is my slide deck, and I will turn over the microphone to Gia, who will talk about tweet chat etiquette.
Thank you, Iris. Can you hear me?
Yes, very well, Dr. Gia.
Okay, hi everyone. Good evening from Manila. And since I'm on mobile, I'll be depending on Aliyah to flash my slides in terms of Twitter etiquette. Okay, Twitter for us in HealthXPH is more of a personal learning network where we learn from each other. So it would be nice if you share relevant materials that would help people learn and may share with each other. Occasionally, you may use it to express, example, what you ate, link to your Instagram or Facebook account, but it's better if we share relevant content. Okay, next slide, please. Okay, if you are live tweeting, example, later on during the HealthXPH chat, you will be bombarded with a lot of tweets. So it is just ethical to inform your followers that in the following hour, you will be tweeting a lot, so at least they are alerted. So alert your followers beforehand. So example, at my Twitter handle, at GSSon, tweeting in a volume in a bit, pardon the volume. So something like that. And please do not forget the hashtag all the time, because that is where your followers would be aware, or you can probably, we encourage you to encourage your followers to follow the chat as well. Next slide, please. Okay, in Twitter, it's all about learning. So when you retweet, meaning to say, if you find someone's content really interesting, it's either, there are 4 types of retweeting. Number 1, you can just click the retweet button. Letter B, if you want to add a comment, you have to include an RT. RT is shortcut of retweet, then the poster's handle, and of course the original tweet after adding your insight. So example, you decided to retweet my tweet, you can add RT at the beginning of the tweet, then what I tweeted. And then you can hold the remark in the end, such as, great, I'm going. Letter C, you may also use via, followed by the. So example, I tweeted something about an article regarding patients attending medical conferences. However, I got that link through Iris, so it is just respectful and ethical to quote her via a via handle, via endocrine_witch. Next slide, please. Letter D, any modification you make in Twitter has to contain the shortcut MP, meaning to say that's a modified tweet before the poster's handle. Or you may label it with HT, which is a hat tip, to extra, quote unquote, thank the poster's handle if he or she led you to a really very relevant content. So any modification, example, just as easy as, example, Bone Doc at Bone Doc said, I go to a hospital here where patients actually cook their meals in a patient support area / building hashtag HealthXPH. If I want to tweet it, but since Twitter is limited to 140 characters, on my mind, I decided to put a shortcut on patients. So the tweet should look similar to this. MT, that's modified tweet, at Bone Doc. I go to a hospital where patients, so I opted to just put PTS, actually cook their meals so instead of the whole word patient, I decided to put PT, support area building, hashtag HealthXPH. Next slide, please. For a hat tip is like when you go to a restaurant, you give an extra tip to a waiter who gives you good service. This is similar in Twitter, but in Twitter it's hat tip. So example, the original tweet came from Royal_College, where the topic on medical ethics issue for us really weighs very much. So I quoted it, but I placed it on my own words. So the hat tip tweet should look like this. I didn't quote the exact tweet of Royal_College, but on my own words, I placed the ethics behind waiting periods for patients via at Royal_College with a link to the tweet. Hat tip to at Cancer Geek, which is Andy, who tweeted that article. So you see, everyone was given the respective credits in terms of their tweet. So that's the hashtag HealthXPH, and there's a hashtag MedEd, where it's all about medical education. So that's the basics of Twitter from my end. So that ends my talk. So we're open to questions.
Thank you very much, Dr. Gia and Dr. Iris Isiptan, for your presentations. We're now open for questions, and I saw that there are a number of questions being posted in our Q&A box recently. I'd like to thank Dr. Mean Sambat from Cambodia for his questions. So let's read on some of the questions that are posted here. But in the first place, Adrian La Paz would like to ask if he can have a copy of the slides presented by Dr. Iris and Dr. Gia. What do you say about that, doctors?
No problem from my end.
Yeah, my slide deck is actually at www.slideshare.net/isiptan.
Right, so you can follow them on SlideShare, and you can also follow up on Twitter for the slides. But surely, I will be sending I will be sending all the resources of this AHIN hour, as they have already approved sending the slides to you. From Dr. Sambat, what is a message versus a tweet in a tweet chat? The question is from Dr. Mean Sambat. What is a message versus a tweet in a tweet chat? I think he's asking on the topic.
Gia?
Over a series of tweet chat.
Well, when you engage yourself in Twitter, it's like conversing with people. It's about connectivity. So for us in HealthXPH, when you message someone or you message something, you want to encourage a conversation to happen. So I don't see a big difference in that.
I think Gia, she was perhaps referring to the direct message versus a tweet.
Oh.
So when you tweet, that actually goes out to the entire world. Even if you are tagging someone, the tweet is public. If you send a message directly, for example, from me to Dr. Gia Season, only the two of us can see what is in that message. And that has happened, for example, for some celebrities where they actually tweeted something that they thought was in a direct message, but was actually sent out accidentally to the entire world. So I think you have to be careful when you're typing, whether what you are doing is a tweet or a direct message.
Okay, it's a direct message. So it's like a private message.
Okay. Another question here is from, let me just check here, from Robert Santos. How do you handle multiple tweets during a tweet chat session? Does it follow a first in, first out, or FIFO rule? And how do you handle less relevant questions or tweets? How do you ignore it?
Okay, that is why we're going to follow it up with the tweet chat later so you can see exactly how fast it can sometimes go. So the moderator is the one that asks the question, and then everybody chimes in all at once with their tweets. Although there is one moderator, almost all of the time, all 5 of us in HealthXPH will be there during the tweet chat. So if there are some tweets that I am not able to respond to as a moderator, for example, Dr. Gia or Dr. Remo, Dr. Narciso, or Dr. Helen will actually be there to answer back. The tweet chat is like a storm of conversation, and whatever flashes on your screen that you actually have something to say about or comment, you just go ahead and type your comment. Which is why afterwards, it is very helpful that Simpler provides us with a transcript. Because sometimes there are people who review our transcript because they cannot join us because they are in another time zone, for example, but they're very interested in what was discussed. Even hours or days after the tweet chat has already finished, some people will be referring to our transcript and retweeting or even answering some of the questions, even if the tweet chat is already finished. But it can really get very fast. What do you think, Gia?
Yes, I agree with Iris. It can be really fast, and sometimes you just find yourself conversing with one, but that's perfectly fine. It takes time. Well, in terms of do we respond to relevant questions, well, for us, there's no such thing as irrelevant question. As much as possible, we want to answer all, but of course, we also recognize spammers. So you know it's spam when they start promoting products. So that's how. Later on, we hope to see you all at the hashtag HealthXPH chat.
Right. Thank you for that very comprehensive answer. Another question here from Dr. Neranga. Dr. Nernaga, is from the Ministry of Health of Sri Lanka. Thank you for the very interesting questions. How do you plan to use network analytics?
We are still trying to figure that out. But for example, in HealthXPH, we are tracking the number of people who are joining us, and we hope to see how our conversations are actually making waves with how many people are actually getting interested in our topics every week. But network analytics, for example, because we are joining the Simpler MedX challenge, although that doesn't use NodeXL, it uses the Simpler tool to actually look at tweets. Our proposal is to actually look at tweets related to gestational diabetes, and they can actually give us a network map similar to what was shown for NodeXL, and we can see who are the institutions or individuals or patient advocates who are tweeting about gestational diabetes, and then we can see what they are up to. For our particular proposal, we actually want to evaluate the links being shared as to whether they are medically appropriate or whether they follow the Health on the Net Foundation code for reliable health information. So we are hoping that once we actually figure out NodeXL so much more, we will be able to publish a paper similar to what was done for hashtag HCSMCA. So that is the healthcare social media in Canada. I think that was what I quoted in my slide deck, where they talked about enabling community through Twitter. So it is actually a study of how health information percolates through a network of connected healthcare professionals using that particular tweet chat model.
All right. There's a number of questions being posted. But I have a question personally to Dr. Iris. How do you handle people who would like to advertise in HealthXPH? Because we know that our work as people in the health profession advocating for education on health issues, there are some people who would like to have their products or their services be featured in our programs or in our interventions in the internet. So how do you handle, or do you have any proposals for advertisements on HealthXPH?
We do not have an advertising model for any of the things we do for HealthXPH. We do not allow any product advertisements. And if you look at our HealthXPH manifesto, it is an item there that we think that we should not be endorsing products as healthcare professionals. That's it, Gia.
Yeah, I agree with Iris. So it's just purely conversation on health and more of expounding connectivity, not endorsing products.
What we have had before is people wanting to come on to the HealthXPH chat to advertise their advocacy. So it is not a product, but rather the things that they have been doing as well. So we have had, for example, Dr. Kate Leritana come on because she wanted to talk about her HIV advocacy. We had Dr. Catherine Lane Mercado, who is working with the Philippine Society of Gastroenterology. She went on the HealthXPH chat because she wanted to share their experience on using Facebook for their hepatitis B awareness campaign. Dr. Helen Madamba has several advocacies as well. She has, for example, talked about voluntary blood donation or protecting women and children online.
Okay, great. I know that as people working on health, we should be very sensitive on commercialization of the interventions that we are doing, because I know that even in blogs and in Twitter, we can be somehow a form of we can advertise basically products which are being proposed to us. But also us in AHIN, we encountered some proposals on that. But as you've said, I also agree with you on that note that interventions that we are doing should not benefit any commercial product. Okay. Another question from me. I would like to ask if HealthXPH is documenting the things that it's doing on Simpler, how do HealthXPH measure the translation of knowledge from tweet to action? So we know that there are a lot of people really interested on the topics that being discussed on Twitter, but how do we see message translation into action within the conversation that we have in tweet chat?
Now would be a good time for Dr. Helen and Dr. Remo to unmute and answer us.
Okay, good evening everyone, guys. Regarding the question about meaning the outputs of the tweet chat, I think it was pointed out earlier by Dr. Iris Tan regarding what we have been able to come up in a year's time. So we had actually were able to convene social media experts or interested in social media and healthcare to a summit. That's one. We were also able to translate into a manifesto the aspirations of people who wanted to push for that advocacy even before we started HealthXPH. And then later on, aside from that, we were also uh, providing a platform for the other advocacies, for there to air it and share their what they're doing on their advocacy, and in fact help them spread their advocacy. I think that's also one of the outcomes that we do with the tweet chats, because during tweet chats we discuss um, these methods in terms of finding the best way in navigating this platform to help these people achieve their advocacy. So I think that's one way, that's one that we have achieved also with the discussion that we're doing on social media. Okay. What else? In the future, we actually really do not know, because the niche is quite new well, especially in the Philippines. And we're hoping that aside from a platform, aside from boosting conversation between um, stakeholders in health in the Philippines, we could also achieve the tweet chat, and HealthXPH could also translate in the areas of health research and education. I think that's one of the goals of Dr. Iris, also going to the conference of Dr. Steve. Thank you.
Thank you, Dr. Remo, on that very wonderful answer. Let's talk about the manifesto, because this is really the time to give more information about the manifesto and how the Health XPH is doing. How the Health XPH is working on it to spread awareness and call to action for the manifesto. Any inputs from Dr. Iris first?
Okay, recently we were informed that certain hospitals have already adopted our Health XPH manifesto. I know that it is being taught in some nursing schools with Mr. Kit Sumabat, who also joined us for the Healthcare and Social Media Summit. Has been also retweeted several times, and we're hoping to spread awareness that way. One of our list of to-dos is to actually have formal signings with specialty organizations, medical organizations, as to their willingness to support the statements of this manifesto. And in fact, there were certain suggestions, for example, to incorporate some of the statements in our manifesto into ethics codes of different professional societies. Everyone has codes of ethics, but sometimes now the codes of ethics need to be updated because there are new ways of interacting between patients and healthcare providers because of social media and online, the internet. So some of the code of ethics or regulations that have to do with behavior did not incorporate this kind of interaction before, so they need to be updated. And we're hoping that Health XPH manifesto will actually be a first step.
Okay, may I add to that? With regards to the manifesto, I think it's important to underline that the manifesto was actually a crowdsourced manifesto. We pulled the thoughts and aspirations of many healthcare professionals as well as patients that we pulled upon from the previous deliberations in Twitch chats and even in meetings, and then we just summarize it into few points to give it more meaning. And I think that's one of the beauty of the platform where the manifesto was born, because it's actually a crowdsourced, so it's coming from people who joined the discussions before that. And before it was launched during the Healthcare Social Media Summit, it was actually an evolving manifesto. And I think up to now, we are also open to um, adding siguro aspirations on the or thoughts on the manifesto, as well as how would other healthcare institution be able to adapt this to their environment, no? Whether hospitals, the academe, and as well as organizations. I think so. Um, that's one thing that we wanted to push through. Although if some organizations are adapting it, and some are also suggesting that it be incorporated into the ethics code. We're all for that also. But I think the beauty there is because the manifesto itself started from uh, it's crowdsourced, no, started from the people who has the better stake in the health. So it's not just we are the only ones who crafted it. Thank you.
Great,
And
great.
just to, I,
Go ahead, Dr. Gia.
Leah, just to add, it's also in our pipeline to get manifesto from the patients, because we we respect of course, it's more of patient centric, and we also want them involved. So it's not just about the healthcare practitioners, the doctors, the nurses, but we would also want a manifesto from the patients. So that's on the pipeline of HealthXPH as well.
Thank you. Before we end, we still have two more questions from our from the Postgraduate Institute of Medicine in Sri Lanka, Dr. Pamod Amarakun. Thank you for the nice presentation. What are the measures you take? This is a question which was sent earlier. Thank you for the nice presentation. What are the measures you take to address privacy issues when discussing on health topics which might be related to patient data on HealthXPH, since we cannot restrict the audience who participate in the chat?
Okay, we have not had a problem like that because mostly the people who join us on Twitter know, for example, that their tweets are their own and do not, for example, reflect their healthcare institution or the organizations that they work for. That's number one. Number two, our topics on HealthXPH have been general, and so there has been no need for people to actually name names or cite very specific examples that might lead to compromising patient privacy and confidentiality. In fact, we have had several tweet chats precisely on how to protect patient privacy and confidentiality online. Any thoughts, Remo, Gia?
Yeah. I agree with Iris that we have not encountered such, and we are very much aware of the manifesto also, that that's our creed. Every time we start the chat, it's really always to respect patient privacy. Really, Mo?
Okay, he's on mute.
Okay.
All right. Thank you for that. This last question is still aligned with the manifesto and the issues that we are tackling. From Ray and Labra, we have the HealthXPH manifesto for healthcare providers, but usually there are also many SOs and non-HCPs who violate the privacy and confidentiality ethics. Would it also be possible if there would be a manifesto for non-healthcare professionals or for the general public?
Thank you for your suggestion. As Dr. Gia said, there is already a plan for a patient manifesto. We have not given thought to having a manifesto in general for the public, but I do know that other organizations, for example, have started telling people that they should be more careful with what they divulge online. We have heard of taglines such as "think before you click," um, and think before you link, or things like that. But I guess if you're saying that maybe we need something also for the non-healthcare professionals, then we are open to that kind of suggestion. We'll see what we can do about that. But the next in the pipeline is actually from the point of view of the patient. Gia?
All right. So, Dr. Gia, anything to add?
Yeah, that's true. The patients will come next. So we hope to, that's precisely why I just want to invite you in a few minutes for the hashtag HealthXPH chat where we will talk about patients. And we hope to soon launch the patient manifesto as well. So we're all on equal grounds.
Okay, I think that's a very good take-off point for the tweet chat, which will happen 9 p.m. Manila time. Thank you very much, Dr. Gia Season, Dr. Iris Isipan, Dr. Remo Aguilar, and Dr. Helen Madamba for being with us on our special AHIN hour this Saturday night. I thank everyone for those who come to our session. I am being bombarded by a lot of direct message from our colleagues in our attendees, especially from those in the from our friends in Sri Lanka, that they really like the AHIN hour that we have tonight. I hope that we could have more of this, and I hope that to see everyone in our next AHIN hour. This is Aliyah Evangelista. Thank you very much, and see you next AHIN hour. See you in our tweet chat also. Thanks, Dr. Iris.
Thank you.
See you.
Thank
Thank
you.
you,
See
everyone.
you.